Good afternoon to all, and thank you for joining a day of learning innovation in feeding programs, brought to you by the American Heart Association and Children at Risk. As the Vice President of Health Strategies with the American Heart Association, Greater Houston Gulf Coast area, I oversee the AHA's work in nutrition security locally and all that comes with it. And many programs with clinical partners and community partners. And so I'm very excited about this event today with some great partners here and all of you in the audience. Before COVID-19, 1 in 10 households in the US were food insecure, at least some of the time. These households were more likely to be households with children, especially with single mothers, those with a high school degree or less, Black, followed by Hispanic, and those with disabilities. Feeding America estimates that as many as 1 in 6 households is now impacted by food insecurity due to COVID-19. Food insecure households with children have more than doubled. Racial disparities have widened. And yet there are solutions to this crisis, and we're delighted to bring you today a team of experts who can help your organization to leverage many opportunities, such as the ones that we'll talk about today, to meet this urgent need. Today's discussion will center mainly around the Child and Adult Care Food Program, otherwise known as CACFP, as an opportunity. Before we do our deep dive and get into our speaker discussions, I just want to prompt you to take a look at the chat box. I believe we have a little survey. This is an opportunity for us to kind of hear from you and get a little feedback from you. And then anything that you think doesn't get addressed from what you put in the chat box, I want to encourage you to bring it up during the breakout rooms as an opportunity. So we'll have a little bit of time together as small groups today. So please go ahead and utilize your chat box. And there's the short survey. Go ahead and click there, and I'll give you a few seconds to do that. So while you're taking a look at the survey, I'll go ahead and just tell you who I am. Larissa Jacobs, I will be your moderator for this event, and I'm really excited to learn alongside you all, because surely there are many things today that we'll get to hear about that I probably have never learned before, so it's kind of exciting. It is now my pleasure to introduce James Abraham, the Branch Chief of Community Nutrition Programs in USDA Food and Nutrition Services Southwest Office, with the USDA, to offer opening remarks. So just a little bit about James. He oversees the Child and Adult Care Food Program, Summer Food Service Program, as well as the food distribution programs for food banks and Indian tribal organization. James and his staff provide federal program guidance, training, technical assistance, and compliance oversight for the state's agencies and tribes in the 7-state region. He has worked for USDA in child nutrition programs and SNAP for over 10 years. And so with that wealth of experience, I bring you James Abraham. So James, let's see, there you go. Myself.
Okay. Great. Thank you very much, Larissa, and to the American Heart Association and Children at Risk for organizing this, and especially to Jenny Iyer for inviting me. I think you have a really great panel here today. So it looks like you've brought in a lot of great operators of the program. Katherine Steele is Wright Steele is an amazing advocate and operator of the program at the state level, and I can see that there's a number of other local level folks here joining us today. So I think this is going to be a really great conversation. Again, thank you for joining, for inviting me, and thank you everyone for joining. As Larissa stated, my name is James Abraham. I'm the Branch Chief of Community Nutrition Programs here at USDA Food and Nutrition Services Southwest Region. As she had stated, I oversee CSFP and Summer Food Service Program, as well as the food distribution and food bank programs for our 7 Southwest states. And so as I understand it, most of you are here today because you've expressed some interest in CACFP, but are maybe not yet a local operator, or you want to partner with the CACFP institution, or maybe you just are here to learn a little bit more about the program. And I think that's so great, because what we want at USDA is to build awareness of this program, because it's such an amazing program and it helps so many families. So I'm hoping that I can illustrate a little bit of the benefits of the program and how it can address hunger and nutrition in your communities. And hopefully you can see how you can get involved in the program. So I'm sure you all are familiar with all of the statistics. USDA's latest report on household food insecurity in the United States found that more than 35 million people are experiencing hunger, and that was in 2019. That's more than 10% of the US population, right? And then in the wake of COVID-19 pandemic, unemployment has soared and food insecurity has been on the rise. And now we expect more than 42 million people are facing hunger because of the coronavirus and because of their economic situation. And that includes 13 million children. And it's not just in kind of the economically depressed communities or what the ones that we view as economically depressed, but rather it's all over the country. There's pockets of hunger that exist throughout America, both in urban, suburban, and in rural settings. So it affects an array of Americans, and we need as many partners at the local level to address the hunger in the places where people are. And the other thing to understand about hunger, especially as USDA-FNS sees it, is it's not just about a lack of calories, right? Millions of Americans get the calories they need, but are still nutrient deficient. So what CACFP does, it aims to provide a nutritious and balanced meal to children and adults. So let me just pause for a second. And I know a lot of you don't have video on right now, but just think a moment for how many of you have had children or have taken care of small children. Just think to yourself, raise your hand if you have your video on, right? So many of us have. I have two small ones myself, and they're constantly hungry, just nonstop hungry, no matter how much I put into them. Now imagine you had no food to give them, or only the cheapest food to give them, right? That wouldn't nourish them. That wouldn't put them in the best health moving forward, right? And so good, nutritious food enables good health. Good, nutritious food is preventative medicine. And that's the way we should really think about it. So as you know, the Child and Adult Care Food Program is a federal nutrition program. It's authorized by Congress and administered by USDA's Food and Nutrition Service. But we couldn't do our job if we didn't have great partners. So we partner with state agencies who then in turn partner with local operators. So in Texas, for instance, we USDA partner with Texas Department of Agriculture, who's here on the call today. And they're great partners of ours, and they partner with the local institution, daycare centers, or daycare homes. And in CACFP, infants and children through age 12 who are in childcare centers and daycare homes are eligible to participate. And then in after-school centers or after-school care facilities, they're able to participate up to age 18. And if you're not aware, CACFP also assists adults who are age 60 or older and are or adults who are physically or mentally impaired. So these adults have to be in a daycare facility. It's not a residential facility, and their eligibility is based on income. But I think a lot of folks don't quite realize that this is also an adult care program as well, and we do have some in every state. So I'm just going to want to reiterate, there are so many childcare institutions, centers, and programs that could be eligible to participate in CACFP, but just aren't currently. Family daycare homes are very common throughout the US, but only a small fraction actually participate in this program when they could. Many after school care programs occur again at schools and at other facilities, but also just don't have the budget to provide nutritious meals. Well, CACFP is there to help them with that budget to provide nutritious snacks or meals. So it's important to understand that there's a variety of operators that are welcomed into this program, from your large daycare centers like YMCA or Boys and Girls Club to mom and pop family daycare homes that are caring for just a handful of children, to small city programs for disabled adults. And we even have major hospitals that participate. We have a few in a few other states, and we're trying to work on getting some in Texas as well. So I just want to in general say that this is an amazing program. It's intended to provide great nutrition. If you don't already know, there is a meal pattern that is associated with this program. So in CACFP, what we have requirements of the food categories that have to be provided. And so they're called meal patterns, and they differ per meal. So breakfast has a meal pattern, lunch and dinner has a meal pattern, and snack, and it differs by age group. So I won't go into every little detail. We have a lot on our website, but essentially there's a group for infants, there's a meal pattern for infants, there's a meal pattern for pre-primary children, and then school-age children and adults. And so in each meal pattern, USDA requires children to be offered all or a combination of milk, fruits, vegetables, meat and protein, and then like whole grain rich carbs. So the goal here is to provide a balanced meal with a variety of nutritious food items, similar to what USDA has exemplified in the My Plate. So again, this is intended to provide nutritious meals, and the program is intended to shoulder some of the cost of providing those nutritious meals to children. So just reiterate that we would love to see you help the children in your community by participating as a sponsor, as a site, or maybe just as an advocate to continue the message of trying to provide nutritious meals to children. Thank you. And if there's any questions for me, I'm happy to answer them.
Thank you, James. That was incredibly helpful. Just a few key takeaways that I heard from you is that really good, nutritious food is preventive medicine. I love that. I'm going to write that on a note for myself to look at regularly because I think it's so important. And then also what we heard from you is that this is available and it's really there to help communities to be healthier. And so people need to take advantage of it. And I hope that's what comes out of our time together today. We would love to see some organizations sign up in whatever way works for them. So thank you so much. That was exciting. And just before I move on with our speakers today, our panelists, I wanted to just kind of reiterate that you mentioned your website. So is that a good resource for us to go to?
Yes, absolutely. I will put it in the chat, the different links. So, and then you'll have that available there.
Thank you so much. That will really be helpful. So check out the chat, everybody. And James is going to put the website address in there for you to hopefully look at any more resources that you might want to take a look at. Let's move on with our panel discussion. I'm so excited about the speakers we have today. We have Katherine Wright Steele, who serves as an administrator for the Texas Department of Agriculture's Food and Nutrition Division. She's responsible for the administration of 14 federal nutrition programs. So welcome, Katherine. Thank you so much for being here with us today. I can't wait to hear what you have to say. And Palak Jalan, who is the Chief Population Health Officer at Access Health Community Health Centers. And fun fact, I actually met Palak, oh gosh, I want to say about 3 years ago, maybe it was, and was just so impressed. I think it was probably her first week on the job. So it's so great to be reunited. I know you're doing some innovative work. I can't wait to hear more about it. What little I know has been really exciting. So thank you for being with us today. And then, of course, Kaylee Hernandez, who's the Assistant Director of Early Education Policy with Children at Risk. Thank you so much, Kaylee. You are also a wealth of knowledge. And thank you again for partnering with us. And thanks to Children at Risk for partnering with us on this event. So without further ado, I will start with Katherine. We've got a few questions here. Through this event, we really hope to increase the number of sponsors and sites across Texas that participate in the Child and Adult Care Food Program. Tell us, what are the responsibilities of a sponsor? Break that down for us so we can understand.
Absolutely, and thank you for having me. I'm glad to be here, and I absolutely love to talk about this program. So sponsors is a good place to start. An entity that wants to come onto the program has a couple of choices. They can start out by being a site, which is usually the best first step, or they can be a sponsor. So a sponsor has a lot more responsibility than a site. They most likely are not themselves serving any of the meals, though. So I guess, again, for any of you knowing how hard it is to sometimes serve meals to kids, you may feel the other way around. You may feel like the sponsors have it easier. But as far as the administration of the program, there's a lot more responsibility for the sponsors. So they will have the contract with our agency, the Texas Department of Agriculture. They will train all site staff before they come onto the program. So if they have a child care center, for example, or maybe a daycare home that's going to start brand new to serve on the program, they will train everyone on all aspects of the program and then train them again at least annually thereafter They will monitor all of the sites that are under their umbrella, under their responsibility, to make sure they stay in compliance. They also offer them technical assistance, answering questions on demand that they have about how to handle day-to-day to planning type of questions and problems. They have to adhere to more stringent procurement guidelines. They submit claims to the Department of Agriculture to draw down the funds to reimburse the sites for the meals that were served. They maintain a wealth of records, and those records are often used when TDA and USDA come in to conduct administrative reviews. So there is definitely a lot of program administration responsibility that lands on a sponsor. But I will say there is the added benefit there is an administrative fee that they take that reimburses them for the work to do that administrative function of the program.
Great. So there are some fees that they're able to use to recuperate some of the administrative costs, so to offset that part of it. Mm-hmm. Great. Well, and I think from what we're hearing from you, just sponsor versus site responsibilities, it's maybe a little more elaborate in terms of being a sponsor. We would like to hear a bit about becoming a site. It seems like there are fewer steps that are required when an organization wants to become a site. So can you share with us, please, what is needed and what do those responsibilities look like that could be included if an organization wants to become a site?
Absolutely. So if your organization has never administered a complex federal program, a site is a very good place to start. In fact, we really suggest that an entity become a site for at least 2 or 3 years before maybe they go out on their own to become an independent contractor or to maybe sponsor other sites under their umbrella. So it's a very good place to start. If you're a site, then you'll have an agreement with a sponsor, and you won't have an agreement with the state agency. So you'll maintain your agreement with the sponsor. You'll have to be sure that what you serve follows the meal pattern that James referenced, meal patterns in this program. You'll be responsible for the enrollment requirements for the participants of your program and maintaining that documentation that as is required by the regulation and by your sponsor. You have to notify your sponsor of any changes, major changes to your enrollment or maybe your licensing, things like that, because it's their responsibility to oversee those things. And you still may be called to be a part of a review from the state or federal agency they may come and do a visit to your site to see how you're serving the meals and making sure you're following the processes correctly.
Thank you. That's great. I feel like James mentioned a few possible types of organizations that could be sites. I feel like he said YMCAs, child care centers, adult care centers, and is there any other type of site that maybe we didn't think of that you want to mention?
I mentioned it a minute ago, but daycare homes. We have a lot of sites that are daycare homes. Yeah.
Great. Thank you so much. And then what are a few things to keep in mind if an organization is deciding between becoming a sponsor versus site? I think you reviewed some of them. So obviously, if you're going to be a site for a couple of years, that will really help you to understand the system you're operating in. But, are there any other considerations between sponsor versus site that you want to kind of inform us about?
It's that level of responsibility. Really, to do the administrative part of the program, you need to be sure you have the capacity for that. This is not a good on the side project for one of your staff that's already incredibly busy doing something else. It takes a lot of time and responsibility. The application process, especially your first time, can be really lengthy to get through. It's a complex process. You have to be able to demonstrate financial viability, financial management competence, and administrative capability and program accountability. So we have a lot of ways that we prompt you in the application so that you can demonstrate that. And it can be a very tedious process to go through. So I think that that's something to think about before you jump into the sponsor level.
Great. Well, thank you so much. That really helps us, Katherine. I think, as we move on through the program, we'll get to hear from some actual organizations that are doing this and can let us know that there's a way to move forward. So thanks so much. I'm going to move on with some questions here. Let's start with Kaylee from Children at Risk. What role do you have in the child and adult care food program? So Kaylee, if you want to come off mute and answer that for us.
Yeah, absolutely. So Children at Risk has entered into a 5-year project with the Department of State and Health Services. And so for the past 2 years, we've really led a pilot program that connects childcare providers in Houston with CACFP sponsors. So we work really closely with them, educating them on the process, helping them sign them up to the point where they can start receiving meals. And then additionally, we've also been monitoring that process and then engaging in case studies and research so we can have those lessons learned and best practices that we can then take and scale to across the state. And so currently we are in the 3rd year of this project, and we are starting to have conversations with folks in Austin as well as other areas across the state to enter in partnerships with centralized kitchens and as well as CACFP sponsors so that they can then connect with childcare providers in their local area and start receiving meals.
That's great. Would you, Kaylee, would you call yourselves kind of the technical advisors, kind of connectors in this space, or how would you kind of refer to yourselves?
Yes, so I would say that we are technical assistant. We will provide technical assistance as we scale this project, but in our pilot project, we really served as that liaison. So we helped, providers tackle any barriers that they might deal with as far as, like the application process that Katherine mentioned. So if they were having trouble filling out those parent income eligibility forms, start, brainstorming different ways that they could, tackle that issue so that it could be a more seamless process.
That's great. Well, thank you so much. There's certainly a role for you all as that liaison to ensure that things get smoothed along the way so we get meals to people. So another question, how do you think the child and adult care food program really uniquely benefits the community that you serve? Is there something that we haven't identified yet that you see that you'd like to share with us? Certainly there are many, many other consequences to being able to go through the day without hunger.
Yeah, so James kind of touched on it a little bit in his opening statements, but we really know that quality, nutritious food, as well as quality early childhood education, really provides that foundation for a child's long-term success and can really be that first step in breaking that cycle of poverty and improving communities. We also know in research that children ages 0 to 5 need quality education in their minds as well as quality nutrition for their bodies. And unfortunately, not enough Texas children are getting access to that with a low participation rate, and that puts them at a significant disadvantage when they start, as early as kindergarten. And then we know just how important, that childcare setting really sets them up for their foundation for future success. And so making sure that we're able to allow, quality, nutritious meals for low-income families, and then also that quality education piece, they work hand in hand as the child develops later in life.
That's very helpful. So really, it's so much more than just providing a meal to a child. It's really part of that individual child's trajectory in life and really part of a good, sound, safe, and happy environment for them in which to learn and to grow. So yeah, thank you so much. I actually have a question for Palak, so I might go down the same road a little bit, if that's okay. Tell us about what role you have in the child and adult care food program. You've done some really unique things in the clinic. We'd love to hear about it.
Sure. Thanks, Larissa. And I would have to give kudos to Jenny for introducing us to CACFP in the first place. And Jenny Iyer was, I guess, the same week that I met you, possibly in my first week of job a couple of years ago. I probably connected with Jenny at the same time as well. And Jenny truly introduced us to the concept. And at that point, I knew, like, as a healthcare system, as a federally qualified health center, we were probably one of the first to see this because of the assistance provided by Jenny in that capacity. As a healthcare provider and as a federally qualified health center, of course, we see, kids below the age of 18 coming through our clinic doors for multiple reasons. Sometimes they have an appointment, sometimes their siblings have an appointment, or they're just, parents are not leaving the kids at home and coming to the clinic as a family. So you'll see a lot more people across our clinics together. The biggest, and I loved, what James and Kaylee shared about, it's not just about food insecurity, but also nutrition. So not just broad calories, what the kids are getting. When you think about from a healthcare perspective, those kids that are coming to the clinic, let's say around the lunchtime or the supper time, they're definitely missing that, free or reduced meal at school. They are coming to the clinic, spending a couple of hours with their family where their parents, either they're sick or somebody in their family is sick. So for us, it was really to address that gap in nutrition security for a really important meal or meals during the day that they're missing out and coming to the clinic for. It was very interesting. It's a non-traditional concept. I still remember our CEO was like, maybe you should check out how the food smells like, and our clinic doesn't smell like balloon or anything else. And so it was really new. And that's just a way to say that it took a little while for everybody to understand the why we're doing it. Once we were able to locate the why for food insecurity, nutrition insecurity, about 40 to 50% of our patient population, including the kids, reported themselves to be food insecure. So now that's 10,000 out of 20,000, which is huge. And knowing, the service areas and FQHC that we serve in, it's the same. So I think that was our experience. We were glad to connect to a sponsor, Houston Food Bank, similarly, and their team has been wonderful. And us serving as a few sites that we have within the organization to provide the meals alongside the education to the kids in the waiting area has been wonderful. There's been so much feedback from families around the same as to what it meant. Our staff saying anecdotally that, you would see parents walking in with like chips or McDonald's or fries, and they stop doing that. They actually come and ask for the meals that's provided, and what that does to that alternative nutrition versus just empty calories and as well.
That is so incredible. I just could listen to you talk forever about how you're serving the community, and just your passion is really evident for being able to do this great work. And, I think just saying some of the things that we heard from you in terms of your why and really being able to respond to the real needs you're seeing in the community is just fantastic. So, thank you for that. I have another question, kind of, along the same lines of benefiting the community. Is there anything else that you can tell us about how you have uniquely benefited the exact community that you're serving? Obviously, there's food insecurity. You made a great distinction between nutrition security and food insecurity. So anything else you'd like to share in terms of how that benefits the community, and are there any anecdotal stories perhaps?
Yeah, I mean, I know like for a period of time, anecdotally, there were kids and families while they would wait and have their meals in that waiting area with the playing and the education that they're getting. They drew from like what their food was before and what their food is after. So you would see like kids actually drawing the food using crayons and colors and letting their parents know that this is what they've liked. And us thinking, like there's milk, there's fruit, it's complete nutrition, probably like not the most attractive for kids, right? There's like, okay, my mom is telling me to eat it, let me eat it, or we'll take it. But we saw that their perception of what healthy food is also change over time associated with that. And now when we see families walk in and truly ask for the meals that are provided for the community, and that's why it's not just restricted to, if you're our patient, that's the only way you can get it. But if you're coming in knowing that this serving as a health center, we're there for the larger community. If you're accompanying somebody, it exists for you too. And I think over summer, we saw numbers really, really shoot up, especially when, kids were not attending traditional school, and they were probably coming more for their examinations, accompanying more of the siblings as well. And hearing from one of the parents who spoke about that, she's never really had the time to figure out what it would look like for her kids to have a fully nutritious meal. And in summer, just having everybody at home takes priority over everything. So besides the hardcore data of seeing our food insecurity numbers go down over time because of this and other interventions. We've seen those stories and those patients come alive because of these efforts, and they go to our front desk. And sometimes it's tough being us; we don't see them day in and day out up front, but the front desk team that really helps run the program gets all the love and share when the family comes in. And I think they asked, we probably had a gap of 15 or 20 days in between, shifting years from summer to that. And I know like that one day I got so many calls. Is something wrong? Is there a reason we're not doing it? Have we stopped doing it? And this is from our staff. So that's really great.
That's incredible. A few really great things that I heard from you have to do with your patient population and the excitement of the data and seeing food insecurity, kind of those numbers going down, but it's also the larger community, not just your own patients. And I think, finally, just nutritious food as a kind of social experience and community building experience. And that is really exciting. So you're definitely doing some incredible work. And, at some point, I'd love to know how many other community clinics are doing what you do. And we would love to smooth the way for those who are not doing it, who think that they can, because I'm hearing how much it's connected you, to your community. So just a brief question. We've got some things in the chat we're going to manage in a second. I mean, Katherine, I've got a couple technical questions for you maybe, but while I've got Palak answering these questions, I want to ask you, what have the costs been to the clinic? Tell us a little bit about that. Does the program stipend cover all of the associated costs? Is there anything you'd like to share with us about, whether this has been burdensome to the clinic or not?
I guess it's more about the approach. Since we're a site, there is no sort of monetary transaction between us and the sponsor. It's more about the resources. So the stipend, I think, goes to the sponsor. We get all the resources that we need associated with the program. So all our operational costs are truly absorbed by the organization, but our approach has been associated with how do we make this a part of our regular workflow and not this new program that you have to do in a special time around, these special circumstances. So, I mean, there are marketing costs, there are costs in, including it during our workflow, but all of those are operational in nature. And we've absorbed it, seeing the value and how the sponsor or Houston Food Bank takes care of like delivering the food. It's there. If we needed any other resources in terms of what that area would look like or any extra supplies, they've always been very amazing for that. So for us, the costs have been absorbed, and this is a part of our day-to-day workflow. So nobody would think, okay, this is in or this is out. This is how we run our operations.
So it's a part of who you are. It's a part of your operations and your way of being in the community is what I'm hearing from you. So that's really exciting. It's not an add-on. It is really part of Access Health. So that's great. So quick question. I'm going to kind of go back. I think I have a technical question about reapplying. This one I will toss to Katherine. Do you have to reapply every couple of years to be a sponsor? What if you decide to go down that route? Is that something you've got to redo every couple of years?
Annually, yes. And the process can be more streamlined after you have initially been approved that first year, but it is an annual process.
Great, thank you, Katherine. And just another quick technical question: are those meals prepackaged? Do they come packaged up?
That are you asking me?
Yes. Does anybody know if you're? I didn't know if you have the technical expertise on that.
That's up to you. You can be a self-operator where I've seen many daycares that they have a small kitchen on site and they prepare all of their meals there. Or just like we heard the example of the clinic where the Houston Food Bank is actually delivering the meals prepackaged, a lot like if you've ever seen a Meals on Wheels pre-delivered package. So there's a couple of different options.
Oh, so I told you all I was going to learn something I didn't know today, because I used to work for the YMCA of Greater Houston, and I actually worked at some of those sites just helping out some of the childcare sites. I had only seen them prepackaged, but that's really exciting. So there are a lot of options here. It sounds like it could be either family style, not family style, but run out of the kitchen or package. There's not a one size fits all here, is what I'm hearing.
Mm-hmm.
Great. All right. Well, we've got a few more questions in the chat, but I think I'm going to move on and just ask of each one of you. Can you talk about kind of the impact to providers for the CACFP program? What does that look like? Obviously, Palak shared with us it from her standpoint in her clinic. Sounds like it's been wonderful. But let's hear from maybe Katherine. Do you have any stories to share on that?
Well, sure. I believe that anecdotally, healthier children, I think that they're healthier and happier. I think they sleep better. I think their behavior is better. I don't know if I could lend that same thing to our adult centers or not, but I know that when kids are getting a better balanced, reliable meal, it really does help cut down on maybe some of the other things that are going on in your community or your culture there at your center. Another thing that's interesting is that last legislative session here in Texas, we have one going on right now, but the previous one, a piece of legislation was passed that required all childcare centers, actually all is probably too broad. HHSC has different types of licensed centers, and so I can't speak to exactly which ones, but the majority, I will say, have to follow the same meal pattern, whether they're on CACFP or not. They have to comply with that standard of a meal pattern. They wanted to see a higher standard being served to children across the board. So I would say if a provider is going to meet that standard anyway, if you're already providing meals, which some of your audience may not be at all, but if that's something you're already responsible for doing, why not come onto the program where there's technical assistance and there's resources and there's reimbursements for the meals that you're serving. So I think that's a big part of the advantage for providers to be on the program.
Yeah, it sounds like it can help the provider with what they need to be doing anyway to have a well-rounded program environment. It can help them to do it in a way that is sustainable and less stressful to really build up their program.
It also can make you more marketable for childcare centers that are putting themselves out there. They've got open spots to fill with kids to say, hey, we follow this high standard and offer this meal at no cost to you. That's a great that's a great thing to offer your families, and so it might make you more competitive over maybe the center down the road that's not participating.
Well, that is great. Thank you so much. And quick commentary too, that you mentioned a piece of legislation. I think that AHA and Children at Risk work together to see that get the support that it needs. So little known fact about the work that Children at Risk and AHA do, working on advocacy. So it's just a little piece there as well. So let's see, another question I wanted to ask. Let's see, maybe Kaylee can answer this one. So CACFP is a meal program that's tied to an educational program. If some of our attendees are not from a school, can you share with us some examples of how organizations could fulfill that educational piece? Let's say you want to be a site, you want to do this, but you're not actually a school. Can you talk us through some of those pieces?
Yeah, absolutely. So most childcare centers follow a curriculum during their day. And so they have a daily schedule that they follow that's developmentally appropriate. And so that actually meets that educational requirement for the CACFP program. And then additional education is if you're working with a CACFP sponsor, many of them, like the Houston Food Bank, provide, educational materials for parents and the students, so then they can learn more about the food that they're receiving, the benefits of quality food, and then they can take that home. So it's just a reinforcement at home.
Thank you. And then also, where can attendees go to find more, or where can our attendees go to find out some more information on CACFP, how it can be used, how to enroll? How does that work? What's the best resource if you didn't mention it?
I
put that out to the
I
group.
know that we James mentioned and put his websites in the chat. I will go and find mine and put them in the chat. We have a lot of really great resources, how do I get started type of things, what do I need to do as a sponsor, and all of those are on our websites. We also have resources in the Education Service Centers, and that's a network of 20 organizations across the state. They have other responsibilities associated with them too, not just our programs, but they have a small office within each of those 20 Education Service Centers that has some experts on CCFP. It's a good place to go if you have struggled to find a sponsor and are looking to find a sponsor, or just have questions about whether you're ready to come onto the program.
That's great. Thank you. I didn't think about that, the education centers, but that's a good point too. Another technical question that might be in the chat box here, but who can become a sponsor? Do you have to be like an approved organization? How does that vetting work?
I'm working with a new mouse today. I apologize.
That's okay. Yes.
Today's
and I'm
my
not a
first
technical expert here either. So.
Full-time day back in our building. So,
welcome back.
Yeah, it's nice. It's nice, other than the construction noise. So a sponsor can be a public or private nonprofit or a private for-profit organization. They have to enter into an agreement with TDA and, of course, meet all those standards in the application.
Oh, great. And I thought I unmuted. So there you go. Okay, wonderful. Well, so it seems like I'm just trying to address the chat box here. Did we answer the final question here too? Upon enrollment, are families in a database? Do they receive a card to verify they can get the meals? Or can they go to any site, or is this restricted to a primary site?
So once the site is an eligible site to serve the meal, the child can receive the site from that meal, depending on which type of program. Now, CCFP has more than one identity. I would like to say there's different ways to participate in CCFP, and in some of them, it does require an enrollment of a child, and you have some enrollment forms on that child. Other ones, like CCFP at Risk, it's open to the community, and it's the site that is eligible. So whomever walks up to that site can be anyone that meets the within the age range that they can receive a meal off of that site. So,
okay, so are they able to toggle among different sites, or are they dedicated? Once I go to, like, let's say I go to Access Health, is that where my home site is?
So the intention of the program is for you not to receive the same meal twice from two different sites in the same day. If you come to one at-risk site and receive an after-school snack and dinner, the program has no way to track you to know if you did happen to make it to another site. The intention is that we educate our participants that we want to provide that single meal for them that day. But you're not assigned a site other than you may be an enrolled child at a center. And when you change centers, you would be enrolled under a different center. The program, I don't track children in where they're receiving their meals at the state level.
Great. Well, that's super helpful. That does make sense. And I just would think, just as a final kind of comment from what I've heard from all of you today, is that once that meal recipient feels really comfortable, let's just say, for example, at Access Health, that kind of, in a way, becomes, their home in some sense. I mean, I know we've heard this from some schools where, families just feel comfortable there. And so that's maybe kind of an added benefit. Correct me if I'm wrong, Falak, but it sounds like people get comfortable. That becomes not only their kind of medical home, but it's also where they can get many needs met.
Right, exactly. I think it's more about the comfort, and there might be, as Katherine was saying, places like there's no way to track to know like if there's one person going to the same site. But I would assume, and at least the way we see it, there's more returning versus, otherwise. And traditional sites are more like folks that have the same folks enrolled in a certain program, right? So if it's an after school program, those kids in some form or fashion are those same kids coming to that program every day. If it is at a school, it's similar. I think we're just unique in that way that we probably don't have the same child return the next day and then the day after because of the dynamics of being a health center. So otherwise, I know but even when they do, this is their parent site for them, even if it's not logistically allocated.
Yeah, that makes so much sense. And I just had an epiphany too while you're explaining it too. I was just thinking a little bit less white coat syndrome, just walk in the clinic and it doesn't feel like you have to be there, but there's something really good waiting for you there. So no, I'm just kidding with you, but I've been to Access Health. I think there's always a sense of community there. So really admire what you all have done. So I'm just going to glance at the chat box. We are a little bit ahead of time. We are going to move into breakout rooms probably a little early, but just a couple of final questions here. Anybody know about really, do the families have to tend to wait very long, or is it sounds like it's pretty seamless? I mean, maybe Palak, since you're the one that's the site, you could tell us what's the wait like?
Yeah, I mean, there's no wait. If there's a really bad weather condition, there might be issues with delivery, winter storm, hurricane, etc. But besides that, I don't think we've had any issues with delivery or getting the food at our site. And the other folks that we know that operate after school programs and may participate as well, we've never seen any sort of major issues other than sporadic in nature.
Great. And so I'll answer the last question in the chat box before I move on to the one above it. And yes, it is the Access Health in Fort Bend in Richmond. That's the same one. So that is where you're doing this, right?
Yeah, we're doing it in Richmond and in Stafford, but yes, it's the same Access Health. Yeah.
I haven't been to all of your locations. I've been to maybe one of them. So, okay. So we had another really good question. Hi, Yolanda, another friend. How are these services communicated throughout the community so families know about it? How are you engaging the community so people know where to go? Flyers, Facebook? Maybe Palak, you can tell us since you're our site expert here.
Sure. It's more for patients and around patients, right? It is open to the community, but there's that fine balance of how much out there we want to go with the communication. So it's really that word to word in flyers and Facebook and social media, but more around internally, anybody that walks through the doors, this is at your eye level, and you'll see that this is offered, whether it's at the front desk before you go into the clinic area where it would say, no food beyond this point, because we do want to make sure that the examination is happening in the sterile conditions that it needs to happen. But it is at the eye level, and it's fun and playful for everybody to notice, because initially we did see what is a healthcare facility doing, advocating for this or recommending this when it was just the first week. And this sort of communication really helped that education piece come in together as to why and how we're doing it.
So it would be a visual nudge. I think if there's traffic going through there and you can see it, you're like, oh, this is unusual. But I think it's really great because you kind of taken the distance and the barrier away from the hunger piece and the clinical piece, which we know is a huge problem across all clinics in Houston and if not across the country. So that's great. So just a final word on the chat box as we manage that. Thank you very much, Katherine, for the TDA website live link that you put in the chat box. People can visit that. We are going to move into breakout rooms. Before we transition, I want to say thank you so much. Katherine, Palak, Kaylee, you were fantastic. Really appreciate you sharing your expertise.
Thank you, everyone, for your time, your precious time, your minutes today that you spent with us. I want to just thank all of our panelists. Y'all did a phenomenal job. I love hearing about the passion about just a really important topic, which is figuring out how we make sure that families and especially children who are in need get fed and they have access to healthy and nutritious meals. I want to draw your attention. There's a post survey. It really helps us a lot. We don't get anything out of it, but other than just to know that you were interested in the topic and whether you feel like you want to follow up with some of the information that was shared or how it helped you. There's a quick post survey that's going in the chat. So keep your eye on the chat. There's a few things we're going to put in there, so fair warning. So that post survey is one of those things. We really appreciate it. And I'll also just close by saying a time when all of our systems, including feeding systems, have been disrupted. It used to be, we thought, well, kids will at least get a meal at school. Well, we know that that's not always a reliable source now. And so it really behooves all of us, I think, to, and we just as a group wholeheartedly implore you that with everything else you have to do, please consider thinking how you access the federal feeding programs that are free and available to you. And also, I'll just add that we've heard some great bright points and some wonderful successes. So if you're doing a really great job and you're doing something that's particularly innovative, whether in a childcare or a medical setting or another setting that maybe we haven't directly addressed today, we'd love to hear about that too, because we want to get the word out and we want to make sure that folks really are really understand that it's worthwhile to make the time investment and the investment of making sure that this is part of your way of doing business, is making sure that these free and nutritious meals are available. So we're going to drop right now a couple of links in the chat from Children at Risk smartparents.org website. One of those, they're both to meals maps. So these are ways to track free meals that we developed last summer when we realized it was really difficult in a couple of regions for families to find where free meals were being offered. So we have one of those for Houston and one of those for the North Texas area. We work together with hundreds and hundreds of partners to make sure that parents, families, if there's someone that you know that needs a meal, maybe you're not ready to become a sponsor yet, but you know there's a need for meals. A lot of sites, a lot of Houston Food Bank sites are listed there. Many other sites, church sites, all the different types you can imagine are there. And all you got to do is just hover over a spot that's near you. You can put in your address. And then it tells you everything you need to know about accessing meals at that site. So just if you know a family that's currently looking for a meal in the greater Houston or the North Texas area, would love for you to share those links. Again, we get nothing out of it other than just that we know that we've been able to just make it a little bit easier to access those sites. And I'll just say all the hassle of the paperwork, all of the red tape that sometimes is one of our biggest barriers is definitely worth it. And one of the other things that came up today is that really a lot of us in lots of different ways are having to meet guidelines anyway. The same guidelines of CACFP that requires. So maybe it's worth taking a second look now that some of those things are in place. And we hope you're armed with some additional information. And now you have some context to make that just a little bit easier. And so thanks again to our panelists and our hosts. And you can always reach out to, if you have kind of a question that's not addressed here, if you just want to reiterate, you want access to some of those resources that maybe you didn't glean from the chat, you can reach out to Kaylee Hernandez at Children at Risk. Her email address is going to be in the chat, or Emily Paul from American Heart Association. That will also be in the chat. So we want to make sure that you'll consider giving it a try, consider exploring, considering talking to someone who can answer some of your questions. And thank you again for joining us.